Good morning and welcome to this Facebook Live at the Raisina Dialogues. And this morning we're talking about bridging the access divide globally, health, gender and tech. I'm Shelley Thakral. I head policy programs for Facebook in India. And I wanted to start off by just laying some of the groundwork. And despite advancements in science and technology, science and medicine, all of the improvements that we've been able to make in this century, serious challenges still persist, and half the world's population are still unable to have the adequate access to health that a lot of us probably in the first world are quite privileged to have that access. And despite that, infectious and non-communicable diseases are still taking their toll, and it's especially critical for the poorest and most marginalized communities who are affected. So joining me today is Winnie and Daisy, both from Kenya, both working in public health. Thank you very much for joining us. And I really wanted to start off by asking yourself, Winnie, what role does tech have in improving access to health? For instance, if I'm an undernourished pregnant woman in Africa, how can technology help me?
Thank you, Shelley, and it's a pleasure to be here speaking at Raisina Dialogue and in India, knowing that India is a very great partner in terms of healthcare for Kenya. And just to add on to your preamble, emerging economies, host half of the population in the world, and some of these vulnerable communities spend 10% of their income on healthcare, of their household expenditure. And on top of this, about 100 million people are pushed to extreme poverty because of healthcare costs. And most of these times, it's the women that you're talking about, and most vulnerable. And technology comes in because it bridges the access topic. You think about a pregnant woman in a rural communities, and the next healthcare facility is about 10 to 15 kilometers. And she's pregnant, she's 3 months pregnant. She needs to have at least a consultation on what kind of supplement she should have in, the kind of nutrition she should be taking, so that in early development for this child in her womb, doesn't cause more issues when the baby is born. So we're looking at things like telehealth services. And telehealth could be in different forms. It could be just text messaging, either with your community health volunteer or your nurse at the healthcare facility. Or it could be a phone call to your community health volunteer, or again, your primary healthcare nurse at the healthcare facility, or even your physician if they're available. And even more advanced would be issues about video conferencing for telehealth. However, the challenges are there that maybe we don't even have the airtime to call this particular person. You don't have the airtime to even send a text message in the rural community. However, notwithstanding, I think technology creates huge opportunities, and the disruptions it's already bringing in rural communities and vulnerable communities is immense. Also thinking about how it's enabling financing. People are able to afford care because they can, for example, in Kenya, they can receive more money from the urban communities and urban areas through their phones, through M-Pesa. So it enables this particular mother to even go to a pharmacy and buy medication.
Daisy, technology inclusive or disruptive? I mean, again, Winnie has kind of very clearly laid out, the opportunities that technology has for improving access to health. But, when you're in the heart of a community which perhaps doesn't have that connectivity or doesn't have access to the literacy that you might need to be able to use technology effectively, what's been your experience?
Thank you, Shelley. Before I answer your question, let me correct you. I do not work in public health. Winnie works in public health. I work in advocacy, and mainly advocacy for women's inclusion. With regards to whether technology is disruptive, I think it's disruptive in a good way, because through technology, we have been able to bridge the information, access to information divide. And you will be surprised that even when you talk about connectivity, maybe it's not 100% connectivity, but you will find that still we have several communities that are able to use technology for so many things. Like Winnie has made reference to M-Pesa. M-Pesa is revolutionary because it has given more control, especially to women. I think one of the things that the mobile telephony has done in Kenya, it has put money in women's hands and given them more control. So using that same idea, there have been some advances. They are private, interventions that are seeking to also provide additional resources to these women and women groups to help them access healthcare, to access funds for healthcare, to save. In Kenya, we're very big on collectives. We call them cooperatives, SACCOs or chamas, where women come together, pool their resources together so that they're able to have greater access to, funds and whatever else they need. And so this concept is being used to make resources available to them through small savings that are then, they're given additional monies. So if you save 50 shillings, a private healthcare company comes and will top up with an additional 50 shillings. So you have available 100 shillings. So as you do it collectively, then you can go, you can access medicine, you can access healthcare. So it's like an insurance scheme. So it is making options available to women that were not there before. So in terms of inclusivity, it is doing that. But we're still far behind because, of course, we have those illiterate communities. But with more and more community health workers being available and trusted by the rural women, these interventions can also be used to help them secure their health. For many, many people, health has been something that you worry about when you get sick. We don't think about primary healthcare issues, basic nutrition, basic checkups, And so through technology, you can get reminders. You can, your community health worker can call you and remind you that you're due for a checkup, you need to go and see your doctor, remind you to eat well, and these things. And so I do think that in terms of disruptive in a good way and making people understand that their bodies are, their health is central to their livelihoods, is working in a good way.
Winnie, while one of the issues is that we're trying to reach more women in terms of improving lives, better access, because obviously that will have a huge impact not only on them but their children. What about in the actual healthcare delivery? What role should women be playing, not only at the front line but also at the back end in terms of improving that access?
Yeah, great question, Shelley. And it's amazing that actually this panel is a full women panel at the beginning of 2020, and the beginning of the next decade. And it's also a privilege that I just closed 2019 also speaking in an all women's panel. But what comes to my mind is we've seen that women are the primary users of healthcare, throughout their life cycle, from birth to basically when you die. Every step a woman has to utilize healthcare. It's either for her, it's either for the husband, it's either for the children, it's either for the parents. Women are 90% most of the time the carers, as well. So it's very important that women are seated at the table where decisions and policies are made. They need to come to the front line, because what has happened traditionally is that, more than 99% of community health volunteers are women. And in most of the times, they're volunteers, they're not being paid. Yeah. And then you have, of course, the men seated at the Ministry of Health. It's the man who is the president in most of the emerging countries and even in developed countries. I think women need to come to the table because they're the biggest primary users of healthcare. They know where it hurts. They know where it pains. And I think more, inclusive policies and financing can be focused on healthcare. As opposed to what has previously happened. And, Michelle Obama said the communities, a nation, and even the world is only as strong as the health of the women, right? And so if your wife is not healthy, then that means she cannot take care of you, she cannot take care of your children. So I think women need to play a more a stronger role at the table where decisions are made and where policies and budget conversations are held, just to drive communities to better health. Yeah.
Daisy, AR, AI, VR, great technology, innovative interventions that everybody gets very excited about. But what would you say is still limiting in terms of the fact that it doesn't substitute for personal relationships or empathy when you are trying to sort of, really build trust amongst communities?
I think that's one of the biggest challenges, the impersonal nature of technology and technological interventions, and even just healthcare interventions. And I will tell you about an experience that we had, on encouraging mothers to go to the health clinics to get regular checkups and begin to interact with available opportunities. Many of them were resistant because they found that going to hospital, dealing with these, medical professionals was very impersonal. And they're so used to dealing with the traditional birth attendants because of the traditional birth attendants are very homely, very welcoming, ask them questions about the other babies because most of the time they're the ones who deliver all the children. And they ask them questions and, we'll give them, a mug of porridge or bowl of porridge or something. And you will find that even when you tell them, when you encourage them to go to healthcare centers or to engage with technology, they're a bit resistant. So I don't know how technology is going to bridge that gap, the impersonal nature of it, because at the end of the day, medical healthcare is really about relationships. Even we like to go to doctors who we have a history with. So we should look at also how do we bring in traditional modes that have been accepted within the community and work well. How do we bring those people in to using technology so that we're comfortable with it, or the people are comfortable with it? And of course, also bringing the men. You'll be surprised about how culture plays a huge role in women's health outcomes, because cultural roles determine how many children they'll have, when they will have them, and the women are sort of like outside of it. So I think that we need also to bring the men into encouraging the women, to take up these, sort of like give them permission, and also start reaching them when they're younger, reach out to the younger women, because we are now bringing more and more girls into education, and we can begin to teach them about their bodies, about how to manage their bodies, about their health and reproductive health outcomes. And this works. There are excellent applications that they can use. I have one that I use, my calendar, which really you can use it as an avenue to understand your body better.
We just have a very short amount of time left, but in that time, I want us to quickly get into our time capsules. Spin 5 years from now, what changes would you like to see?
I would like to see government take a more active role in making access to technology and technological interventions for reaching the unreached, and not so much private sector. I still am very resistant to the idea of privatizing, fully privatizing social services. And so I think governments really need to step up and work with private sector to develop interventions that can actually work for the delivery of health care, primary health care, in terms of information to the citizens, and make citizens more and more comfortable with discussing their health.
Thank you, Winnie.
I think in one sentence, we need to collaborate globally for healthcare, because without healthcare, we don't basically have anything. Healthcare is hope, and when you have hope, you have everything. So collaboration on a global level.
Thank you so much. That concludes our session with both Daisy and Winnie, and I really want to thank you very much. We haven't given justice to this conversation, and I really hope that that you can send in any questions and really take course for action. Thank you.